All right, welcome to another Stopping Socialism TV video. I'm Donald Kendal, joined as always by Justin Haskins. Justin, one of the things that we talk about on our stoppingsocialism.com a lot is the concept of universal healthcare. It seems to be one of the backbones of the one of the big things on the top of the want list for the liberals and the democratic socialists is this idea of universal healthcare, government-controlled healthcare. So I wanted to kind of talk about just kind of some of the horror stories that come along with it. You know, get people prepared for this when it comes down the pike here. So, what you got?
Yeah, so I think what people need to understand, first of all, about single-payer healthcare and really any government-run system, but the things that have healthcare in particular has a lot of sort of moral controversies. There's a lot of people who disagree about a lot of things in healthcare. You know, people think of abortion and physician-assisted suicide, and there's a bunch of other things like that. And I think that the important thing for people to keep in mind is that when you put the collective in charge of healthcare, paying for healthcare, the collective will decide ultimately what is allowed and what is not allowed, how it's going to be managed, how it's not going to be managed. There is not an infinite amount of healthcare supplies, staff, facilities, drugs, all sorts of other things. And so there has to be rationing. Rationing is an essential part of any kind of single-payer healthcare plan. And so when they actually have to, on the surface, when you listen to Bernie Sanders and Alexandria Ocasio-Cortez and other people, they love to talk about it like, oh yeah, we're just going to provide everybody with as though if the government just pays for it, well, then the problem is solved. But the problem isn't solved. There are all sorts of logistical problems. There are all sorts of issues related to managing costs and bureaucracy and everything that gets tied into that. And because government is really, really, really bad at managing anything, when they're put in charge of it, you end up with all these inefficiencies, which leads to rationing and all this other stuff. And then in addition to that, because the collective is the one who is in charge in a government system, the individual doesn't really matter. The collective matters in any kind of socialized system. Individuals who are in minorities, minority groups, and most people think of minority groups as racial minorities. I'm not even talking about that, just other kinds of minorities in society. Those people end up being the ones usually that get screwed. And when we're talking about healthcare, that's particularly problematic. So one really good example of this, I don't know when this actually happened. I think this was 2018 or 2019. Yeah, 2018. There was this in vitro fertilization drug that couples use in order to help them have children. Some people who struggle to have children, they have to take these drugs in order to have it, in order to have a better chance of having a child. And so in this particular case, they had a limit on this drug. I think it was because there just wasn't enough being produced. The demand exceeded the supply. And so The Guardian reported in 2018 that the National Health Service, which of course is the single-payer government-run system in the United Kingdom, had to decide how they're going to manage this drug, right? So how do they decide who gets the drug and who doesn't get the drug? There's a limited amount of it. How do they make that decision? So it said, The Guardian reported that couples are being turned down for National Health Service fertility treatment in some areas of England because the man is too old or too fat. That's their word, too fat, despite neither criteria forming part of national guidelines or being proven to affect the success of in vitro fertilization. So in other words, there's no scientific reason for why a fat dad can't be a dad, but for whatever reason, they don't want fat men having children, or at least it's not as desirable as someone who's a thinner man having a child. And so they made the decision that couples that included a fat guy aren't going to be eligible for this drug. So this is a really good example. It's not about whether you're a good parent. It's not about whether you're more qualified or wealthier or can provide for your children or more educated or any sort of qualification that you might think would be something that people would look at and say, well, maybe some of these things might help you be a good parent. Maybe they don't, but maybe they would. Instead, they look at how fat is the father. And that's really the situation, that you see in the United Kingdom. So that's the first example, and I think it's a really interesting one.
Well, yeah, and I've seen stories too about like different areas of the UK and then deciding not to pursue certain treatments because I think it's specifically with IVF that like because it's too expensive, and it always goes back to this one concept for me that's like if you're going to put the government in charge of anything, whether it's healthcare, whether it's the government paying for your kids' school lunch, then it becomes political. Suddenly, we're going to have votes on whether or not bologna sandwiches are going to be allowed. Suddenly, we're going to have votes on whether or not fat dads can get this treatment for their family. Like everything becomes political. It's kind of scary.
Yeah, no, that's absolutely true. No question about it. So another great example, National Health Service. This actually comes from the New York Times, believe it or not. It was in a story about rationing related to the coronavirus, but they threw in that this was an incredible statistic that they included in this article from the New York Times. It starts off by saying, denying life-saving care to conserve public resources is nothing new for Britain's National Health Service. Again, National Health Service, that's the government-run healthcare system. In expensive treatments for cancer and other diseases, the health service officially limits what it will spend to postpone a death. £30,000 or about $37,000 for each year of full quality, and quality is in quotes, quality life provided to a patient. Think about that for a minute. So they've sat down and figured it out. They figured it out. A full year of a quality life for you, whatever that means, is worth $37,000 for them. So if it costs them $40,000 in order to provide you with an additional year, they got to put that into the calculation. That's not really good for them. So they got to factor that in. This is what, we keep, the right has been talking for years and years and years about rationing and death panels and all these other things. And we constantly are told, that's all conspiracy theory. We don't really do that. And here you have the New York Times opening up this story by saying denying life-saving care to conserve public resources is nothing new for Britain's National Health Service. It's unbelievable.
Yeah, no, it's pretty frightening stuff. So what, $37,001? They're like, nope, sorry, you didn't meet the threshold. Bye.
Yeah, it's crazy.
Well, it's the idea of scarcity, right? One of the basic core cornerstones of the economy, of economics, is the idea of scarcity, right? There's scarcity in everything. There's scarcity in food. There's scarcity in medical services, and it's how they're going to divvy it up. So rationing comes hand in hand. It's a requirement when you're talking about this stuff. I've got a good rationing story from you. This for you. This comes from a book called Arguing with Socialists that Justin and I were contributors on. And on this one section where it's talking about rationing in the healthcare system, it talks about the concept of group therapy approach to all kinds of healthcare treatments. Sounds great, huh? So it says, it is billed as an attempt to alleviate strain on family doctors, many of whom complain of being overworked, the Telegram reported in October of 2018. Group appointments of between 10 and 15 people with the same condition have been piloted in SLU in Berkshire, London, Birmingham, Manchester, Sheffield, Newcastle, and Northumberland. So, doctors at the Royal College of GPs annual conference said the groups were a fun and efficient way to carry out consultations with patients who shared the same conditions. So yeah, it's pretty fun stuff. Everyone gets to go sit around in a circle with 10 of their peers talking about their hemorrhoid condition. Sounds so much fun. It's that great, everybody?
It's just absolutely incredible. And there's so many other things that we could point to. I mean, there are literally millions and millions of these stories all over the world. If you just track them down and find it, there's people suffering all over the place as a result of this. Look, if the government is in charge of it, it is not going to work well. Yeah. That's just the bottom line. It's not. Can someone show me a single example of a government-run system that works really well? There is none. No one ever provides an example of something that actually works. And the crazy thing is, we all know, even even a person who's far to the left as you could possibly be, will admit that there are government systems that don't work well. And yet, instead of just focusing on fixing those systems before building whole new massive, complex healthcare systems, they decide they're going to go the opposite direction. It's like, why don't you fix the things you're already responsible for first? Yeah. And then you can make the argument for building this big, massive monstrosity. But no, let's just pile it on. We know Amtrak sucks. We know the DMV is miserable. We know all these other government-run things are terrible, but we're going to add an even more complex problem onto it. I mean, they already have a failing healthcare system, government-run healthcare system. It's called the VA healthcare system, and it is woefully underfunded, and it is poorly managed and full of corruption and all sorts of other things that we've learned about over the past, couple of decades, and yet they haven't fixed that. Why don't they start there if they care so much about healthcare? If they're not going to take care of our veterans who have literally served in war, who have been, in some cases, they've lost limbs and things like that, fighting for their country, why would they care about just John Q, taxpayer walking in off the street? Why would they care what that person's going through? They're not. They can't run anything effectively. That's the whole problem with this stuff.
Right.
And you see it all over the world in a variety of different ways, but healthcare is probably the most important issue for you as an individual person. If you get sick, it becomes your world. That's everything to you, what's going on in healthcare. And so putting them in charge of that is putting them in charge of people at the most important parts of their lives, at birth, at death, when they're sick, when they have surgeries, etc. And so it is to give them that kind of power over our lives when they've proven they can't manage trains and the Postal Service is ridiculous.
Yeah, there's no doubt. And for all of those people that, think that Trump is the root of all evil when it comes to our government. And it's just this person that you think is an absolute buffoon that's in office, you want to put that government in control of this healthcare system. It just makes no sense to me. I just don't get it. Somebody explain that to me.
Yeah, it makes absolutely no sense. Why would you ever, if you think that government, everybody in America essentially, or the vast majority of people in America, have hated a president in their lifetime.
Right.
The vast majority of people who are, over the age of 18, let's say, have hated a president in their lifetime. And yet half the country wants to put someone they hate in charge of the vast majority of their lives.
Yeah.
That makes no sense.
So that they can pen executive orders that make some arbitrary distinction on weight or any other number of conditions that would prevent you from getting some type of service in the healthcare industry.
Right. And can you imagine being one of these people who has been trying to have a child and then you're told, nope, sorry, no kid for you because, you're too fat. I'm sorry, but you're too fat. Can you imagine the suffering and the pain for those people? And so again, if you had just been 30 pounds lighter, then the collective would have determined that you're more fit to be a parent. That's how arbitrary this stuff is. It's totally insane, but that's the process. I found it especially interesting, this particular story, because I'm not suggesting that they should do this, but you could make some kind of argument that someone who's maybe morbidly obese, who's a woman, because of childbirth and the process or something, maybe they're at health risk or something. I mean, I don't know anything about that, but maybe there's a health risk to that, right?
Sure.
But the father, there's nothing. What's the health risk? There's no health risk. They just arbitrarily decided they couldn't pick women because they knew how that would go. They knew that wouldn't work.
Yeah, that's not going to fly.
That's not going to fly. So they pick men instead because it's way easier to pick on the father. And they say, all right, well, we got to come up with something. Are you too old? Are you too fat? Then you're a bad dad.
No.
It's just insane.
And if you think these lines of rationing are going to ease up in the future, like it's insane. There's going to be more restrictions and more withholding and more rationing. And eventually, instead of a group consultation with your doctor with 15 of your friends, it'll just be like 100 of your friends.
Yeah.
Everyone at once.
Right. And not just your friends, people you hate.
Oh yeah. Just
people not just random people you don't like. Like, that's the thing. People you met in the waiting room who you're like, that guy over there, that guy's a real jerk. And now you got to talk about your diabetes with this guy in the room. Like, this is terrible. This is terrible. And just a point of clarification here. Just a point of clarification. It's not in the United States. The rationing that would occur is not likely to get worse over time. It's actually likely to be horrible right from the start.
Sure.
Because essentially what we're doing is we're saying, you know what, let's provide 25 million people who don't have access to any health insurance with health insurance tomorrow without adding a single doctor, a single nurse, a single physical therapist, nothing. We're just going to, all of a sudden they've got health insurance. Then let's take millions and millions of other people, tens of millions of other people who do have health insurance, but who may not be able to afford to pay for something really expensive. And let's give them the ability to pay for that too, without adding a single surgeon, without adding any of these other people into the mix. So obviously we need to expand the healthcare system. We need to provide those people with access to affordable healthcare so that everybody has it. But the idea that you can just do this tomorrow when the system's been broken for decades and decades and decades, and that all we have to do is just start paying for it with the government and that will solve all of our problems, is actually not true. The healthcare system in many places is operating at near full capacity when it comes to surgeries and all sorts of expensive treatments anyway. So paying for it is not going to add significantly more of these things without increasing the number of surgeons and facilities and all of these other things that the government, by the way, has been capping for years and years and years. For decades, they've been putting caps on the number of MRI machines that you can have and hospital beds that you can have and all this other stuff. So hospitals have actually been restricted. They're not even meeting their demand in many cases right now. But now you want to add tens of millions of people to the system overnight without adding a single healthcare provider or facility or new medical machinery or anything else. This is a recipe for immediate healthcare rationing, not rationing off into the future. I mean, this is going to be at its worst in the first couple of years that they do it. And that's so tragic, because you'll have people dying, waiting on waiting lists, dying because there's just no way for them to get the surgery that they need or whatever, because they did nothing to expand healthcare supply. All they did was just effectively expand the ability for people to pay for it. And that's just, it's totally absurd. And it's going to be made even worse by the fact that they're going to underpay all these people. And all these healthcare providers will be underpaid. And this isn't a theory. They're openly saying that they're going to cut reimbursement rates. That's the one way that they're going to pay for this. So if you're cutting reimbursement rates, you're encouraging doctors who've been around for 20 or 30 years to retire, to get out of the business entirely. You're discouraging younger people from going into the field. This is a train wreck. This is going to be a nightmare if this actually happens.
No, it's amazing stuff. Amazing how obtuse some people that are calling for this system are. But I think that should do it for this segment. This is Stopping Socialism TV. If you want to see more videos like this, go to YouTube, Stopping Socialism TV. You can also find a lot of our content on Facebook, Stopping Socialism. You can also go to stoppingsocialism.com. And we have a Twitter account, we have a Parler account, we have an Instagram account. So you can find us on pretty much all of social media. Justin, where can people find you?
At Justin T. Haskins on Facebook and Socialist Twitter.
All right. Thank you all.